Hi, I'm back for week 8 of the student fieldwork series in hand therapy. So this week was really good. It was a good week. I feel like I was a little bit more confident this week, and I think that that's kind of one thing that kind of goes back and forth sometimes. One time you might feel like, okay, I'm really starting to get the hang of this, and then the next time you're like, oh, nope, that didn't work out so well. But I think that that's kind of, a learning process for sure. I'd say that this week, one thing that went a little different for me was evaluations. So I know we talked earlier on that the evaluation process was kind of starting to feel like it flowed more, which I think still is the case, but I hadn't done an eval for a little while now, maybe like a week or two. So this week I had two evals that I did towards the end of the week, and I feel like those might not have went as smoothly as they may have been going because I feel like one, I just get nervous, which I think is, a thing that you do when you're not used to doing something all the time. But then I also think I just, there for a while I was doing I was doing a lot of different evals. So they started to flow a little bit better and I started to get the hang of things, which I think I still have, but it just wasn't as fresh in my mind. So I think that that was one challenge that I kind of had this week. But other things that were going well are I have found that my favorite thing to do with patients is miniature Connect Four. So there's like a travel size Connect Four in the clinic, and I think that that's like a really versatile tool. You can kind of use it in a lot of different ways. You can use it for fine motor, in a lot of different aspects. I have people, picking them up with their fingers, but then I also have some people picking them up with resisted clothespins to get a little bit more pinch strength going on. So I think that that's one thing that I've just found this week that I have really been enjoying getting to use with different people in different aspects. And I think that something that's really I'm starting to feel a lot more comfortable with, just branching out and trying different things. This week there was an example where in theory, the, treatment idea or intervention that I had planned was like it was great in theory. I was like, oh, this will work out perfectly. I'm gonna um use this to work on extension because typically that was something that I would work on with a patient with that kind of diagnosis. And I brought it out and I was like, yes, this is gonna go great. And then my supervisor was like, do they actually have a problem with extension or like do you have a goal for extension? And I was like, good question. Nope. So, in theory, that was what I thought would be great. And it's something that made me it reminded me that you need to go back to your goals, go back to that initial eval and be like, oh, like these were their range of motion measurements, this was their grip measurements, this was their pinch measurements, these were my goals, this is what I'm going to focus on. Just because, say, I think it was an intervention for trigger finger, say it was, maybe typically those people have problems with extension, but this individual didn't. So when it comes to that, you have to go back to that individual, make it meaningful for them, make it something that is what you were going to work on. So if you didn't have a goal for that, or if they didn't have any deficits in that, why was I doing a goal for extension? So I think those are things that you just start to become more aware of and remember, like, hey, you need to go back to this. And I think that was something that this week I really honed in on because it was something that I was just reminded of by my supervisor. And it was something that was rightfully so, because I think there was times where I was kind of getting stuck in like a lull period where I was like, oh, I'll just do this. But like, why was I doing that? You need to make sure you have reasoning behind why you're doing the things that you're doing. And if you can think of the reasoning behind it, I think that you need to have reasoning for everything, for one. But when you can explain the reasoning behind it more so, it makes everything flow better. And it also helps you to understand it. Because if you're just going to pick something and be like, I'm going to do this, but why? I know why can be like the devil's advocate question, why? But really to learn and to understand, you need to know why so that you can best serve your patients and best serve yourself pretty much. Because as a student, if I was just constantly doing these things and I'm like, oh, I don't know why I'm doing this, but I'm going to do it anyhow. It may be right because you've seen it before, but that doesn't mean that it's going to help you in the long run because you didn't actually understand what you were doing. So those things are also times where I'm like, I think I know why, but let me like talk this out. And which is something that I still need to improve on. And I know that sometimes I think I understand it in my head, and then to try to get it into words, I'm like, that's not going great. But that's okay, try. And I think for me, that's one thing I've been trying to do. I've been trying to ask more questions that I may know some of the answer to, but I don't know all of it. And I've also just been making sure that I ask the questions, even when I don't necessarily maybe feel like comfortable. Not saying that I don't feel comfortable asking questions because I 100% do, but sometimes I know that like people are busy and I don't want to be another problem or burden. And in this case, like maybe I went in a period of time where I didn't ask as many questions just because I was like, oh, well, I feel like I'm just gonna like annoy my supervisor, annoy other people because I keep asking questions. But I think that I was reminded, just ask the questions. You're here to learn. And if you were never told, hey, don't ask any questions, don't do this, then you're just making that up in your mind, which I probably was. So, ask the questions and make sure that you are doing the work and gaining all that you can out of the learning experience because you're here to learn. This is your time to, if you're going to make a mistake, you're going to make a mistake, but just learn from that and turn it around because this is the time to do that. And it's one of those things where, excuse me, certain things might be really, you might understand certain things, but then another thing, you might understand parts of it. So then ask about that other part or ask, hey, am I on the right track here? There's been times where I think that I know what I'm going to do with the patient. And then you might just need a little extra reassurance or a little extra explanation about, okay, so I'm going to do this exercise because this, and this. But do you think that's a good idea, or do you have any other suggestions? Because then it shows that, hey, you know what you're talking about to a certain extent. But then you can also get that expertise from your supervisor, which really helps things out. So that was kind of my week 8 experience, and I am excited for week 9.